Hello everyone, welcome back to my YouTube channel Dr. Shweta Singh. If you are new to this channel or watching me for the first time, then please like and subscribe my channel and press the bell icon for early notification. So today in this video, I'll be talking about the topic gingivitis. What is gingivitis? Let me first introduce you the definition of gingivitis. What is gingivitis? The inflammation of the gum tissues surrounding the teeth is known as gingivitis. What is inflammation of the gum tissues surrounding the teeth? Okay, I will show you image of gingivitis. So here, can you see this? The inflammation of gum tissue surrounding the teeth. I will zoom this for you. Okay, now is it visible? Now here, can you see this? The inflammation of the gum tissue. Okay, now coming to the stages of gingivitis. There are 4 stages of gingivitis. I will be discussing one by one. So first coming to the stage 1. The stage 1 is known as the initial lesion. Its duration is of 2 to 4 days. Okay, what is stage 1 known as? The initial lesion and duration 2 to 4 days. So there are changes occurring in this lesion. Okay, what are the changes? There are vascular changes consisting of dilated capillaries and increased blood flow. So there are few vascular changes in this stage, that are the dilated capillaries became dilated and blood flow is increased. Now, initial inflammatory changes occur in the response to microbial activation of resident leukocyte and subsequent stimulation of endothelial cells. Why inflammatory changes is occurring? Because of the response of microbial activation. So, activation of microbes. Okay, in the resident leukocytes means the white blood cells, and the subsequent stimulation of endothelial cells too. Okay, coming to the next slide. Clinically, this initial response of gingiva to bacterial plaque is not apparent. Now, in this stage, it is not visible clinically. Okay, now subtle changes can also be detected in junctional epithelium and perivascular connective tissue. So, junctional epithelium is also affected and perivascular connective tissue is also harmed. So, perivascular connective tissue matrix become altered and there is exudation and deposition of fibrin in affected area. So, what is happening? The connective tissue matrix altered. Because of that, there is exudation means discharge and deposition too of fibrin in the area which is affected. Now lymphocytes also begins to accumulate. Lymphocytes also started to accumulate here. Now increase in the flow of gingival fluid into the sulcus. There is increase in gingival fluid in the sulcus. Whether this initial lesion resolves rapidly with the restoration of the tissue to a normal state or evolves into a chronic inflammatory lesion. So, this lesion can also resolve rapidly, but on the other hand, it can also evolve into a chronic state. It means it can also be dangerous if not treated properly. An infiltrate of macrophages and lymphoid cells appears within a few days. Infiltration of macrophages and lymphoid cells also start appearing after few days. So what is clinical finding here? Clinical finding is the gingival fluid flow. If it is visible clinically, it is easily detected. Okay. Now, coming to the second stage. The second stage is known as the early lesion. The early lesion evolves from the initial lesion within after 1 week the beginning of plaque accumulation. So, understanding my point now, if the initial lesion is not treated, then the early lesion evolves within or after 1 week. If within or after 1 week it's not treated, then the second comes to second stage and the beginning of plaque accumulation. Plaque accumulation is the main factor here. As the time goes on, clinical signs of erythema may appear. With the proceeding time, the erythema occurs. What is erythema? Erythema is the redness of skin either in the limited area or overall. So, erythema can occur either to a limited area or overall over the gingiva. Okay, now erythema is mainly because of proliferation of capillaries and increased formation of capillary loops. Why erythema occurred? Because of the proliferation of the capillaries, and there is increased formation of capillaries loops too. Now here is the picture. Yeah, here is marginal gingivitis and irregular gingiva. Here can you see these now, these loops now, and the irregular gingiva also here. Okay, now coming to the next slide. The gingival fluid flow and the number of transmigrating leukocytes reach their maximum between 6 to 12 days of onset of clinical gingivitis. After the 6 to 12 days of clinical gingivitis, the number of transmigrating leukocytes, means white blood cells, reach to their peak. Okay. Now collagen destruction also increases. There is collagen destruction. Circular and dentogingival fibers are mainly affected. The fibers which are affected most are the circular and dentogingival fibers. Now there is also alteration in the blood vessels. Now PMNs are attached to bacteria and engulf them by phagocytosis. PNM is polymorphonuclear leukocytes. Okay, so PNMs are attached and to the bacteria and engulf them by the process of the phagocytosis. Phagocytosis is the process by which living cells called phagocytes ingest other cells. Okay, now coming to the next slide. Fibroblasts show cytotoxic alteration with decreased capacity of collagen. So collagen formation is decreased here. Okay, collagen destruction is related to MMPs, which is matrix melanoproteins. Okay, now what is clinical finding here? The clinical finding here is also the gingival fluid flow, but they're increased. Now coming to the next slide, the third stage. The third stage is known as the established lesion. It is characterized by predominance of plasma cells and B lymphocytes. So here plasma cells and B lymphocytes are main points here. Yeah, now here the B cells found are of immunoglobulin 1 and immunoglobulin G3. Okay. The established lesion can be described as moderately to severely inflamed gingiva. Here in this, the gingival lesion is moderately or severely inflamed. Okay. Now condition is getting worse here in the stage 3rd. So now it is in the stage of chronic gingivitis. What is chronic gingivitis? It occurs 2 to 3 weeks after the beginning of plaque accumulation. What are the changes here in this chronic gingivitis? Blood vessels become engorged or congested. Here blood vessels is congested and so there is lack of blood flow. Okay. Venous return is also impaired. Now blood flow becomes sluggish. Sluggish means slow. So what is the result of these? So there is gingival anoxemia. Anoxemia means lack of oxygen. Now that causes gingival anoxemia, which superimpose a bluish hue on the reddened gingiva. So because of this points now, there is gingival anoxemia means there is lack of oxygen in the gingiva, and because of that there is bluish hue on the reddened gingiva. I will show you pic of that here. See, this is the bluish hue on the reddened gingiva. Here, can you see now? Okay. Now coming to the next slide. The collagenolytic activity is also increased in inflamed gingival tissue by the enzyme collagenase. So enzyme collagenase is here working, and collagenolytic means the degradation of collagen start occurring. Now chronically inflamed gingiva have elevated levels of acid and alkaline phosphatase. Here acid and alkaline phosphatase levels also get increased. Some remains stable, but some seems to be more active and convert to destructive lesion. So in few cases the lesion stay established for few weeks, but in some cases it is activated and convert into destructive lesion very rapidly. So what is clinical finding here? Change in the color, size and texture of the gingiva. Now coming to the last stage, the fourth stage, the advanced lesion. It is known as stage 4 is known as the advanced lesion. So extension of the lesion into the alveolar bone characterizes fourth stage known as advanced lesion or phase of periodontal breakdown. Here this is the worst stage. Okay, so in this the alveolar bone is also affected, and this lesion is also known as phase of periodontal breakdown, because periodontal activities also occurs here. Okay, more plaque accumulation. The plaque accumulation is increased day by day. That's why the condition is worsened. Microscopically, there is fibrosis in gingiva. There is fibrosis. Teeth with non-inflamed sites have longer life than the inflamed one. The teeth which have non-inflamed sites can stay for a longer time in respect to the inflamed one. Okay, there is risk of periodontal attachment or loss of teeth too. So there is it's a risky stage, and there is risk of periodontal attachment loss. It means the gingiva can detach, or loss of teeth can also occur. Gingival recession occurs if then the teeth become mobile slowly, and slowly you can lose the teeth. Okay, so these were the topics on the gingivitis, and in the next video I will be covering the clinical aspects of the gingiva, clinical findings and symptoms overall, and the different types of gingivitis too. Okay, so thank you for your time.